Hi, everybody. I'm Morgan Davidson. I am the Director of Marketing and Communications for the Canadian Liver Foundation, and welcome back to our Meet the Researcher series. If you've seen any of these interviews so far, you know that the goal of this series is really to connect you, our community, with the very people who are leading innovative and exciting research in the liver disease space, which really ultimately helps us accomplish our mission of bringing research to life. I am really excited today to be joined by Dr. Mamatha Bhat. Dr. Bhat is a staff hepatologist and clinician-scientist at University Health Network's multi-organ transplant program and an assistant professor at the University of Toronto's Division of Gastroenterology and Hepatology. The goal of her research program is to enable a precision medicine approach to long-term complications after liver transplantation through a better understanding of their mechanistic basis. We've been a proud funder of Dr. Bhat's work, and she has been a recipient of our designated liver cancer research grant in Canada. And since October, and we're talking about liver cancer and liver cancer awareness, it's a really great time for us to connect with her. So thank you so much for joining us today.
Well, thank you so much for the invitation, Morgan. And it's really my pleasure to speak about the research that the Canadian Liver Foundation and its patients and donors have funded. So it's really a pleasure for me to be here with you today.
Fantastic. I know I sort of covered the biography version of your work, but maybe just to start us off, you can tell us a little bit more about the work you are doing in the liver care research and transplant space, maybe just in your own terms.
Sure. So as you mentioned, I'm a liver specialist and a clinician scientist at the University Health Network, and I lead a translational research program to look into liver cancer as well as fatty liver disease post-transplant as a model to better understand aggressive liver disease, and so get lessons from that to inform better care of liver cancer and fatty liver disease. So we use a variety of approaches. We look at different types of samples and use different research models to better understand the mechanisms behind aggressive liver cancer, for example, post-transplant. So there are many people nowadays who are receiving a liver transplant for the indication of liver cancer. So 35 to 40% of recipients in our program, for example, are receiving a liver transplant as a cure for liver cancer. However, there is recurrence that may occur in 15 to 20% of patients, and it tends to be biologically a bit more aggressive than, say, non-transplant cancer. So we'd like to better understand what are the mechanisms that cause this type of cancer to be more aggressive after transplant. And so that was really the topic of one of the grants that the Canadian Liver Foundation has funded. Now, in terms of my overall program, I'm very fortunate to have a wonderful research team with a diverse skill set. So they have bioinformatics expertise as well as expertise with different research models. We also look at samples from patients who have had recurrent liver cancer or liver cancer to better understand what the mechanisms are and how we can use this to inform better care and better health of patients with this condition.
Yeah, it's incredibly important work, and we know that liver cancer is definitely top of mind for a lot of people in our community and something to be aware of. So you did mention, and we've already talked a little bit about the grant that that we were able to provide for this particular project. And I just want to sort of expand on that a little bit more because, we often say when you support the CLF, your donations fund research. And it's just exciting to be able to talk about, like, this is exactly what that is. These are the funds that we are able to put back into the research community that goes into the work that people like yourself are doing. So can you tell more about that particular project and what you're working on and what you're learning.
Yes. So one of the projects relates to recurrent liver cancer, as I mentioned. So recurrent liver cancer, it tends to be more biologically aggressive. And so we're using this as a model to understand when liver cancer becomes more aggressive. Part of the reason is because patients are on anti-rejection medication after a transplant, so if you think about the immune system, it's actually a brake on cancer cells. So it constitutes the first line of defense of the body against cancer, the immune system. So when patients are on anti-rejection medication, and if there are some cancer cells in their body, then that cancer will tend to behave more aggressively. And so the grant that the Canadian Liver Foundation kindly funded was actually to examine the mechanisms behind this aggressive form of recurrent liver cancer and understand how it relates to the original tumor on the liver that was removed from the patient at the time of the transplant. So really understanding what are the commonalities and the differences and why it is that recurrent liver cancer after transplant tends to behave more aggressively. And so we can use that information can be used then to understand the best approach to therapy and even chemo prevention. So preventing that recurrence, but also treating those recurrences. And what we did also in that grant is compare that evolution. So from the original tumor to the recurrence, we compared that to another setting, which is recurrent cancer after hepatectomy or surgical resection for liver cancer. And so that is in a setting where there is no anti-rejection medication at play. So you're looking at two settings where there's suppression of the immune system and absence of suppression of the immune system, and seeing how cancer evolves in those two settings. And so by understanding how there are differences based on the immune system of a patient, we can really understand what makes cancer more aggressive in the immunosuppressed setting. And overall, there are lessons from this that we can then use for liver cancer as a whole. You know, better understanding how we can prevent aggressive liver cancer and treat it more optimally.
Right.
So that was one project, actually. So I was very fortunate actually to receive 2 grants from the Canadian Liver Foundation over the last 3 years.
Right.
So I can also speak about another project that was funded, which was to look at lipid-like nanoparticles. So nanoparticles are basically a vehicle to provide therapy. So this is a type of nanoparticle or vehicle that was created by a collaborator, so Dr. Gang Zheng. And so he's devised these very nice nanoparticles that allow for provision of cargo, meaning therapy, or it could be RNA-based therapy to deliver this directly into liver cancer cells. So the nice thing about nanoparticles that are like lipids is that they tend to move directly to the liver. They tend to migrate to the liver cells. And we have noted that these vehicles tend to go into liver cancer cells preferentially. And so what we also know is that often patients with chronic liver disease and cirrhosis who also have liver cancer have difficulty tolerating chemotherapy and any therapeutic interventions because their liver is not functioning normally. So this sort of vehicle that can deliver something directly into the liver cancer cells is quite ideal for patients who have liver cancer, because it will allow for directed delivery into liver cancer cells without the systemic side effects. So we're actually studying this in our research models to see whether this could be translated ultimately to the clinical setting to provide therapies safely for liver cancer.
That's amazing. It's so fascinating to hear
Thank
you talk about it all, because yeah, like it's even just for me working with the foundation, I've got my head down day to day in a lot of operational stuff, and I'm on the marketing side and things like that. And so I don't always get to like really absorb the really specific work that is being done. We're obviously aware of what we're funding and who we're working with, but just to be able to even learn more in depth about the research being done as a result of the funding we're able to provide. It's so fascinating, and it just really reinforces how important this research is, and so it's incredible.
Thank you.
What either in your own research or just in the liver disease space in general, what are you really excited about right now? Like any progress that you're seeing or breakthroughs or things that we're learning in the liver disease space that are really exciting?
Yeah, I think, one very impressive development in the last year and a half is RNA therapeutics. So I think really with the research around COVID, there's been this sort of explosion of RNA-based therapeutics and interest in RNA-based therapeutics. And I think really that bodes well for the liver disease space as well, because as I mentioned, it would be ideal, particularly in patients with chronic liver disease, to have directed delivery. Now, the interesting thing about the liver is that whatever goes in the circulation will often, it will go to the liver. So as I mentioned, nanoparticles in general will migrate to the liver preferentially. And so I think the nice thing about RNA-based therapeutics, if you marry that with, say, nanoparticle technology, there is really this great potential for treating liver diseases in general. So liver cancer, liver disease in general, but in a very focused manner without having to rely on liver function overall, because the concern is whenever patients have liver cirrhosis or chronic liver disease, you worry about their ability to metabolize or metabolize medications. So I think this is like one very important development. I think the other thing, and this is a space that I've been working in as well, so artificial intelligence, machine learning tools applied to data from liver disease and liver cancer. I think there's a lot of potential to better understand the mechanistic basis of diseases by looking at various types of data and allowing that to inform predictions about prognosis, about survival, and grouping patients into clusters to better understand what is the best therapy for this particular set of characteristics. So I think that's the nice thing about this era, is that there's been a lot of developments in that space as well, the artificial intelligence machine learning space. And I think there's a lot of potential to derive benefit from that in the liver disease space.
Yeah, definitely that, and even just the mRNA developments. Considering we've all really this has been a really tough time, it is incredible that there's been some silver linings and breakthroughs, and not just in liver disease. It's been amazing to see just the breakthroughs in other disease spaces as well. So
yes,
definitely exciting. Pulling it back kind of outside of your work and really just getting to know you a little bit better. What do you love most about your job and what you get to do?
Yeah, I think, the main thing that I like about my job is the variety. So there's always something stimulating about both my clinical work as well as my research work. So from a clinical side, I'm very fortunate to look after patients who have end-stage liver disease and take them through the process of getting to transplant. And then I take care of them during that time of transplant and look after them over the years of life, second life that they have.
Right.
So it's really a privilege to be a part of that process and be able to look after patients, when they're at this pivotal time in their life.
Mm-hmm.
And the thing about the liver is that you don't have dialysis, you don't have anything to keep people alive until a transplant. And so that really means that they need that liver, right? So
Right.
there isn't anything to keep them alive until a transplant happens. So it really leads to this sort of kind of dramatic feeling. The patients and their families really are waiting for that. And when it finally happens, it's just a miracle, right? So for
Right.
us too, it's really amazing to see that, that transformation that occurs after a transplant. So from a clinical side, I really enjoy that whole, getting someone through that whole process and then looking after them for the many years of life during their second life. So that's from the clinical side. I think from the research side, I've been fortunate to work at the University Health Network and close to University of Toronto, where there's various collaborators who are international experts in different types of tools. So as I mentioned, the project looking at recurrent liver cancer, I'm working with an international expert in epigenetics or methylation. And so that's the nice thing about Toronto, like where I work, is that you have this ability to interface and crosstalk with such great experts and bring those tools into your own research. And they're just a phone call or an email away. So that's the beauty of bringing such novel tools into the liver disease and liver cancer space. So I really enjoy that whole process of dialoguing with these experts who are just, say, a block away.
Right.
And
Yeah.
I also have a wonderful research team now. So I've been able to build a very nice research team and just have wonderful people working on my team to further knowledge in this space. So yeah, I really enjoy having both of those aspects as part of my day-to-day.
What about outside of work? How do you, I mean, it sounds like this work keeps you very busy.
Yeah,
So,
it does.
What do you do to kind of step away from that and take a break and unwind?
Yeah, so, I have two young boys, actually. So two little boys, 4 and 6 years old. So I really enjoy spending time with them. So when I come back from work, I spend that time with them in the late afternoons, evenings, just playing and taking them out to see the trains.
Yeah.
They're really into trains. So yeah, I mean, I take that time with them. I really enjoy my time with them. And, it's a nice time to spend doing various activities.
Yeah, at that age, you've really
at
got
that age, it's a lot of fun. Yeah, and my husband too. So, we spend time together as a family, and that really takes me away from all of this. And and it's good to have that break and then come back the next day recharged.
Yeah, absolutely. A different kind of busy when you're at home, but
yeah. I mean, there's all sorts of, funny things that happen. They're at an age where their interactions are very funny to, very nice to watch.
I bet.
Too. So, yeah.
If for some reason, you went back and you had to choose a different career path, totally unrelated to what you do now, what do you think you would have done?
So you're saying I'm not allowed to say research, right?
Hey, if that's where you feel like you'd have wound up anyway, then that's fair. I'm just always curious. Sometimes, people say.
So I, in my previous life before medicine, I used to play the violin, and
Oh, wow.
I was heavily involved in music. So I guess you could say, if I were to choose another career, I would have been in the arts, like a musician or,
That's so
I
interesting.
play Indian classical music on the violin.
Wow, that's incredible. I'm always so blown away by violin players because it just seems like such a tricky instrument to learn. But
it is, yes, yeah, because the position of the fingers has to be just right, and the pressure of the bow on on the strings.
Wow.
So
Do you still play at all now, or?
not really, but you know, so my son, my older son, goes regularly to violin classes, so weekly. So I take him and I practice with him. So
Oh, nice.
yeah,
That's nice to
so
be able to reconnect to it in that way. It's so
yeah,
interesting that you say that, because when I've asked that question to most of the researchers we've spoken to have said something that's kind of more in the creative space. And I just think it's so interesting that, as a group, it sounds like there's an appreciation and a value that a lot of people who work in medicine place on the arts and
on the
creativity
arts, that's
to kind of
right.
like counterbalance the very sort of logical, like methodical work of research and medicine. So it's interesting, but I love it.
Well, actually, there is significant overlap. Like if you think about research, actually,
Yeah,
there's a lot of creativity that's needed to generate new research ideas. And I think that that's the nice thing about the violin too. You know, there's a lot of potential for creativity and improvisation on
right.
such an instrument that, you know, very nicely simulates the human voice and the modulations that you can have in the human voice. So yeah,
Yeah.
I see
Huh.
some, you know, I see
Yeah,
some overlap
overlap.
there.
Well, maybe that's why, most of the people I talk to say something along those lines, music or art or of some kind. So that's incredible.
Thank you.
Well, this has been really lovely. I think
Thank
it's really
you.
exciting to hear about the work that you're doing, and in particular in the transplant and liver cancer space. So thank you for doing that work. It's so important, and I know that people watching in our community really value and appreciate all that work being done. So thank you so much for your time today.
Well, thank you so much, Morgan. And I'd like to sincerely thank all the patients and donors who are members of the Canadian Liver Foundation and have been working so hard to support the great work of the CLF and the research we do. So my sincere thanks to all of you.